Hey guys, welcome to the treatment room. I have got gorgeous Taylor on the table today, and what we're going to do is film a HydraTite method facial. So what this entails is, of course, sanitation. We've got our cleansing steps. We've got our HydraTite steps, which are radiofrequency skin tightening. I'll talk through all of that. We're going to do some awesome massage. We'll talk about some ingredients also, because why not? And then, of course, the hydrodermabrasion, which is really important. So this is great for anti-aging. It also helps with fine lines and wrinkles, really produces collagen up under the skin, but also introduces hydration. So people that have anti-aging concerns, fine lines, of course, collagen production, and then just want a very fancy facial that incorporates modalities, this is the one for you. So you'll enjoy that. So first things first, we always hand sanitize, glove up, and hand sanitize again. So normally we would wear a face mask moving into what we're dealing with this year. And of course, that's going to be going on for a while. But for the purposes of me demonstrating and talking through, we've discussed and made sure Taylor's good to go for me not to wear a mask right this moment. But as of now, you're going to wear a mask in the treatment room or any kind of face shield, anything you need, but we're always going to be gloved, okay? So first things first, I always enjoy getting our client relaxed, right? Mm-hmm. I'm sure Taylor needs this today. So I always tell students that right back here, the occipitalis muscle is really important just to kind of pull on a little bit, release the head from the neck, from that spine. Do a little bit of shoulder compressions with body weight. And you can incorporate aromatherapy. I like aromatherapy. So lavender, I even put some lavender on myself this morning, along with some frankincense. I like citrus, lemongrass, all of that. We're going to massage those earlobes a little bit. And then we're going to feather off. We're going to hand sanitize one more time. And we're going to pull up this chair. All right. You good to go, Miss Taylor? Thank you for being our model today. All right. So we have got a couple things here. I have got a very nice, just kind of purifying cleanser that's got AHAs and BHAs in there. That's going to be for cleanse number 1. Then we're going to get down to the skin with some botanical ingredients for cleanse number 2 and add in some of our granular scrubs. So that's really nice for deep cleansing that skin before we get into the modalities. I'm going to take a brush and we're going to apply this purifying cleanser. Let's talk a little bit through. I'll move this out the way, put it back here. We're going to talk a little bit about what's in a cleanser such as this. All right, so we have got glycolic acid, lactic acid, and salicylic acid. Got a little bit of that scrub on my fingers from putting it on the palette. I'm sure you don't mind. Exfoliation is key. So the first thing is first. Glycolic acid is an alpha hydroxy acid that produces mitosis of keratinocytes. Y'all remember that, right? Absolutely. It's got a molecular weight of 76, and then it's going to produce new cells. So we like glycolic acid for that. And in your cleansers, that helps to break everything down. And before I get into the next ingredient, make sure you follow along with the pattern of the strokes that I'm doing with the brush. I've got a grounding hand on the client here. And then, of course, I'm bringing the brush up the bridge of the nose, down and around, up the bridge of the nose, down and around. On the cheeks, we can do some figure 8s, some circles. Come over here, same thing. But here's the key to facial brushes, is that you don't want to do a choppy, right? No choppy strokes. Taylor remembers everything I'm saying because she's in aesthetic school. But everything should have some sort of a flow and effleurage pattern here on the décolleté. And then we're going to feather this off, place this behind us, dip our fingers in a little bit of water, and come around to do some medium pressure massage into the skin. So be careful of nose rings, piercings, things like that. And if this is too heavy-handed, you just let me know. It's always nice to be a little bit on both the light and the medium pressure. Of course, on facial muscles, you don't want to be too deep. That's important. But something that helps with blood flow and circulation. I'm going to get around those lips, come around these nasolabial folds, up onto the zygomatic muscle here, up into the procerus and corrugator muscles. Pinch on those eyebrows. Roll this down around the orbicularis oculi. I know my anatomy, don't I? And then some more effleurage right up under here. That's the platysma muscle, right? And then feather off here. We're now going to grab a hot towel. These are freshly made, of course, each time. I was teaching a class yesterday to some of our new low course students. Of course, we're going to test. And we talked about sanitation, and we said that it's very important to make sure that you clean out and disinfect those hot towel cabinets every day. Very important. And you make fresh new towels at the beginning of each day. You can also put a little aromatherapy in your hot towel cabinet as well. All right, so back to the ingredients in that cleanser we're talking about. As we do her tight face wrap here, hold the corner of the mouth wrap tight. Hold the other corner of the mouth wrap tight. We're going to compress. So we said glycolic acid, and then the next one is lactic acid, which helps to infuse a little bit of hydration, believe it or not. It's an alpha hydroxy acid that exfoliates, yet hydrates, has a molecular weight of 92. And we love that. And I hope I said that glycolic acid has a molecular weight of 76. So you see that they both have a lower molecular weight than, let's say, citric acid, which has a molecular weight of 135. So you want things that are going to go down into those pores, clean everything out, produce mitosis of keratinocytes. Okay. You want to make sure your gloves are, of course, tight. These are mediums. I definitely could go down to a small with these, though. We're going to grab the corners of this towel and work this off the face. And while I'm doing that, I'll tell you a little bit about that third ingredient that's in that cleanser, and it's salicylic acid. Salicylic acid eats away at dirt and debris in the pore, which is good for pore tightening and also just deep cleaning everything, getting all those comedones out of there, and it helps everything penetrate just a little bit better. So that's perfect. And we're going to feather off. Place this in our dirty linens pile and hand sanitize. And we're ready for the next step. Okay, so next step is going to be cleanse number 2. I'm going to dip my brush in a little bit of the rest of my nice AHA BHA cleanser. I'm going to pair it with my nice botanical cleanser since we have those side by side. And I'm going to place this here for now, and I'm going to come over here with a grounding hand and apply. So again, as estheticians, you know, whoever's watching this, you may do this with your fingers, you may do this with a brush. But I feel as though professionally it's a good idea to use a brush when you can. Things like the massage techniques, you can place your brush down and of course use your fingertips and some pressure to get into that. Okay, we're going to feather off at the temple. I'm going to grab a little bit more of my cleanser. Okay, we're going to come over here. So generally in every single facial, you're going to do a double cleanse. And we always say first cleanse is to take off the dirt, debris, makeup, anything like that. Even if you're not wearing makeup, you should do a double cleanse, right? And then the second cleanse is to deep cleanse that skin. So here we go. We're going to feather off. And when I say deep cleanse, we're going to come back with a little bit of our granular scrub. This is a physical exfoliant we're going to add right on top. And this one's got some medical grade crystals in there, which are really abrasive, but we love that. We can add it to a little bit of the cleanser. Come over here on neck and décolleté, and I'll grab a little bit more. We'll put this palette behind us in a moment. So the key to second cleanse is always to do a little 5 to 7 minute massage on neck, chest, shoulder while this is sitting on the face. You want to let those ingredients penetrate into those pores and exfoliate. So here we go. We've got it nice and applied in an even way. We'll put this behind us now. Okay, then hand sanitize. We're gonna come back. I'll grab actually a little bit of water on my fingertips here, and we will massage. How does that feel? Too rough or just right?
Just right.
Good. So I always say, everybody generally can do a physical exfoliant in their facials. And I think sometimes we think, well, gosh, you know, if they're more sensitive skin and I'm doing a chemical peel that day, I might not want to go that route. Try it. What's going to happen is if you're not doing things like microdermabrasion, it's going to get off all that dead skin on the top, and you don't have to be super harsh with it, right? You don't have to be super harsh with it, but that's going to get off all those dead corneocytes so you can actually penetrate that peel where it needs to go. So no peel is being applied today. Of course, we're going to use our other modalities, but you'll have to come back and let me do a peel sometime. Not that you need it because you have pretty skin. All right. So of course, this is that moment where we have got scrub all over our gloves. So we're going to change our gloves. It's kind of completely up to you if you want to massage with or without gloves. I always say utilize the gloves as much as you can. And then if you want to do little massage stuff like hands and arms or neck, chest, décolleté with your bare hands, then go for it. But make sure you always hand sanitize first, hand sanitize, glove up, hand sanitize again. Okay. I'm sure you feel very exfoliated now. We're going to do another hot towel. And I always say for state board, you have to do your little test on your wrist. Come over here, take the V, place it around the neck, compress, compress, compress. That always feels good. We're going to take the straight edge here, pull it up underneath your lip, hold the corner of the mouth, wrap tight. Hold the corner of the mouth, wrap tight, compress, compress, compress. So here's where we're going to keep that hot towel on the face, and the only way you can do that is when you do hold the corner of the mouth with the towel there and wrap all the way over, and then all the way over, and that way it's going to stay. So before I remove the towel, and before I remove my gloves, I'm going to grab some gauze. Okay. We're going to dip it in a little bit of water. And I am going to semi-aggressively try to remove this scrub off her décolleté so we can get into her awesome massage, which is my favorite part. I'm sure it's her favorite part too. I'm gonna dip one more time in that water. And then I've got my little foot pedal trash can over here where I'm going to dispose of the gauze and my gloves. Make sure you have a foot pedal trash can in the treatment room. You don't need to touch the trash can, right? Okay. There you go. You're gonna have a gorgeous décolleté now. So here we go. We're gonna foot pedal this in. We're gonna hand sanitize. And then I'm going to check to make sure we've got a little bit of granules left, no big deal. Okay. And then we're going to come in for some massage. I left my big wedding ring off for you, girl, so we could do some good massage. And you can roll the head over into your forearm and really get up into this shoulder. And the movements don't have to be all over the place. They can be slow and methodical, but with some pressure. A lot of folks get all this stress built up here in the neck and those shoulders. And I wish someone would do this to me. Maybe I'll be next. But just to get all this released away from your spine, we can come over here, do the same. So we'll continue with this for a couple minutes. One thing I'll say with the HydraDermabrasion coming up is we're going to do a little cleansing step with that. Then we're going to get into our RF skin tight for about 10 minutes. And then we're going to get into our antioxidant infusion with our HydraDermabrasion machine, and then serum and sunscreen. So make sure you really get into the massage piece of this service, because we're going to use those modalities. So you got to kind of mix it up a little bit. Get those muscles right here on the chest. Roll it down. This is a great service, the HydraTite, to do before any sort of special event. If you don't want to do a chemical peel on your client, doing something that infuses a lot of skin tightening along with the hydration factor is a great choice. Some people just don't like to peel from chemical peels, especially before something like an event or a wedding or just in general. Sometimes it's just good to give it a break from chemical peels sometimes. Okay. So now that we've got our client relaxed, we're going to hand sanitize, glove up, and hand sanitize again. I always say 2 pairs of gloves per facial. And this definitely takes a moment after we've been doing some massage. But letting that heat sit on the skin with a hot towel is a great choice, right? That's going to help to open up those pores to be able to receive everything. Okay, so to my left and your right, I have got a HydraDermabrasion machine, okay? We've got a couple different things we're going to do here. I'm going to go ahead and press the on button, get that going. You're going to hear it. Put it on my other glove. I will show you the wand. I will show you the wand. But first we're going to hand sanitize one more time. I'm going to make sure I have a little bit of gauze handy for anything that I need as we're removing. One last compression. Grab the 2 corners of the towel, wrap it around your index finger, and start working that product off the skin. Being careful around the nose, make sure you get on the upper lip. Pull to the side and never down, right? Pull to the side always. We're going to kind of roll this up into a little rod here and floss to the left, floss to the right. Get everything up under that jawline. And then we're going to feather this off. I'm going to grab my gauze now. We're going to need to wet the gauze just a little bit. We're going to wrap this around our index fingers. Dip it in a little bit of water. Come around and make sure we get off all those granules. That's important. So, have you had the HydraDermabrasion before?
Yes.
Okay, she says yes. Any issues or anything with that? Are you good with the suction?
Yeah, everything's fine.
All right. I'll talk through the suction a little bit. Because what I see with Taylor, she's got gorgeous skin, absolutely no problems, right? But she does have a few little broken capillaries here. So I want to be careful about that. I have got my handpiece, and it's important, and there's many different modalities and brands, of course, that have machines like this. You want to make sure your handpiece is not turned all the way up. You don't want to spew water out, but you most certainly don't want it to be all the way down. Okay, so now we're going to make sure we do our deep cleaning step. I always hold my finger over it to see that the liquid is coming up into the machine, making sure all is good. And this is a disposable tip that's new, so I just put that on there. Okay. So as we work this on the skin, I like to lay out my solution and then pull. The point is to hydrate the skin. It's not to necessarily cause a ton of broken capillaries or trauma to the skin. How you feel? That's okay for you? So what I'll do is I'll do a couple of dots to lay out my hydration, and then I'll drag, but not drag too far. I see a little something in that hairline. I'm going to make sure I go over that. And then I'm following along with my less dominant hand. Number one, to hold this off of her face, the cord. But number two, to massage in that additional hydration so it's not just running down her face. Be careful around the eye area. I'm going to pull this up around the nose. You okay with your little nose ring? Going to get on that nasolabial fold. Taylor's young, but folks that come in for this procedure for HydraTite, they're going to want to work on those nasolabial folds. Going to get on this jawline, pull. Lay it out and pull. Massage in the excess moisture. And of course, on the neck, I kind of hold up here as I pull down, simply as to not drag the skin down with the machine, right? Everything needs to be going upward. So if you have to do a down movement, you want to hold the skin up real nice and tight. We'll come around here to the chin. Folks get lots of blackhead matter right there. So again, laying that down and pulling up. And the interesting thing about any kind of hydrodermabrasion machine is it pulls up all that nasty matter into a little container on the back of the machine. And if you look at our vacuum suction, it can be up to a 20, but I have it on 18. I don't want to be too crazy with it. And you can certainly turn it down. Getting that side. And we'll come across the upper lip in just a moment. This is where people lose a lot of collagen and elastin, and of course my favorite term, the glycosaminoglycan. They'll lose it around the nasolabial folds. And what will happen is, women as we get older, and men too, you can start getting this loose jowl area here and things start to drag down. So even though someone might have really pretty, gorgeous skin, what looks like aging to most people is the loss of elastin and collagen, which drags the face downward. And a lot of folks, not our model today, but will have that cystic jawline acne. If it is hormonal, lift your chin for me. Hold down as we pull up. Because we don't want to just hold our left hand in the air and then pull down or up, right? We want to kind of keep everything nice and taut. We're going to get in this submental fat pad here with the RF skin tightening. And then real quick, we'll do a nice drag of hydration on that chest. Always massage in any leftover liquid. We don't want that dragging on our client, or dripping rather. Okay, how do you feel? You okay?
Yes.
I'm gonna turn this off. There's a little, computer screen here with an on and off button to where you can either scoot up the vacuum, scoot it down, but you wanna make sure you turn this piece off, which is the cleaning step. Take your handpiece and place it back into the container, and that way it's contained. All right, you feeling okay? We're gonna hand sanitize again. And here is what is the important piece, is the use of a Glide solution, very thick heavy glide solution for the RF skin type. So we're going to apply that, but the key is to making sure all of that gets off the skin when you're done with it. You can't take the RF skin tightening machines and drag it across the skin. It won't feel very good. But what we're going to do is we're going to do this lower half of the face, and we're going to do the submental fat pad. I'm probably going to change my gloves now. So you can do this with, of course, just your gloved hands, or you can apply it with a little applicator tool, whatever works for you. Okay. So while I'm changing gloves, this is our screen, okay? And this particular machine has got different modalities. It's got different things. On this side, you got the suction that comes with the RF, which is radio frequency skin tightening. I'll talk about what radio frequency means. Then on this side, this is just straight RF. So we're actually going to use the handle, this one, that is for the face. Place that there. I'm going to make sure that as I click on this little floppy disk here, I'm going to click on number 4, which has to do with face, okay? It's on 35% intensity, and I want to make sure she understands that, okay? And then I'm going to scoot this down to 10 minutes, okay? That's what we're going to do. All right, so I'm going to put this in the trash. You feel all nice and greased up, girl? We're going to hand sanitize, glove up, and hand sanitize again. But Taylor's ready to go. So one thing to remember, Taylor, is, and you know this, but we're pretending that you don't, right? The intensity. That's going to really bring that heat up, and it's going to be a little shocking. It's going to be one of those things where I need you to raise your hand for me, right? If you need me to turn it down, and then we'll do it. The key is not to shock your clients, right? Because we don't want to cause anybody to have a burn, of course, and we want to make sure that they're comfortable. All right. And last but not least, I'll just grab a little piece of gauze just in case I need that. And here we go. So we're going to start in one area. And what's going to happen is Taylor's going to feel this warm up. Probably not so much right this minute. But she can kind of feel this interesting sensation where it can turn out to be a little bit of a metallic taste in her mouth, potentially. You've got the radio frequency kind of sending alternating energy waveforms into the epidermis and dermis, which is great for collagen production. But you've got these little probes on the end of this where it sends energy to each one. So it's traveling through her skin and then back into the other little pole. And I'm holding the skin really tight over here. How you doing on the heat? Okay. This is where people need that build up. So I think a lot of folks wonder, well, you know, why do you not do it under the eyes or on the forehead? You can. However, that skin is normally very thin. It's going to heat up a lot quicker. And it's not necessarily suggested. Now, if she were to have had some, not under eye circles, but under eye bags, that would be a different story, right? If she has under eye bags, that can actually go right up under there and flatten that out a little bit and tighten it. You doing okay? Mm-hmm. So we're going to do, for the purposes of this video, 5 minutes on each side. So I'm going to take a look, of course, at my screen. We're going to get up under here, lift your chin, lift your chin. The submental fat pad is everything as we get older. That starts to grow or not, but we want to flatten that out for most of our clients. And then the key is to get in the green zone over here. You'll see on the screen, it's in the green zone at 41 degrees. So it needs to be between 39 and 43 degrees Celsius. Luckily, you don't have to test the temperature yourself with a little temperature gauge. You can actually just look on the screen, which is what I love about this one. So you see as I move around the face, if the skin's gotten cooler, it'll start going back down a little bit, but then it'll, warm up. And I'm trying to move around so Taylor doesn't get too hot, but I'm staying on this right side of the face. Are you okay?
Mm-hmm.
We like relaxation with facials, but when you're using modalities involving heat, you really got to talk to your client a little bit. And what's neat is if you did one side of the face and set up the client, you could truly see a difference in lifting. But I always love this sort of thing. I always say that good, better, best with skin tightening is microcurrent is good. Microcurrent, where it tightens facial muscles. Okay, but that's all that it does. It tightens facial muscles. Then radio frequency skin tightening sends, we got about a minute and a half left on this side, sends alternating energy waveforms that produce nonspecific localized heat in the dermis and epidermis to produce collagen a little bit deeper. So RF skin tightening is better, right, than microcurrent. Although there's a big love for microcurrent out there. And I think it's good to do both, right? A little bit hot.
Mm-hmm.
Yep, you just tell me. You don't have any nasolabial folds yet, girl.
Mm-hmm.
Good for you. Yeah, the chiseled jawline, that is a big thing on Instagram now, and kind of utilizing cosmetic injections and different things to really formulate that. But by doing radiofrequency skin tightening, you can do that without injectables. But back to good, better, best. I always say that laser skin tightening is just by definition a little bit better than all the others, which we're not doing today. But laser skin tightening is a great thing. It's going to help to produce just straight up collagen because it goes down deep enough where it does not go in the epidermis. It bypasses the epidermis and goes straight to the dermis. So you've got some really good options as estheticians, depending on what oversight you need, of course. Okay, 20 seconds and I'm moving, I promise. You'll be happy about that. You feel like we're getting a lot of heat up under here?
Mm-hmm.
That's an important area, I feel like. Okay. And we're going to move on over. So the key is to kind of make the decision. Let's see, I'll do something like this. I never want to drag cords, so if you need to run it around you, hold it. We don't want that falling in her face. So you see it goes back down. So the degrees over there on the screen are about 39. It's not quite, oh, see now it's in the green zone. Once it's been heated up, the machine, it gets the skin a little bit hotter, a little bit faster on that second side. So what I think I might do after this is a very quick oxygen mask, Taylor.
Mm-hmm.
And then we'll get into the antioxidant infusion with the other machine, Serum and Sunscreen. Love that. That'll help clean out your pores, and that's a really great choice after something as thick as the Glide solution that you have to put on the skin.
Mm-hmm.
I'm sure you find that as an esthetician yourself to be a little tricky.
Mm-hmm.
You doing okay? It's in the green zone, so I know you're warm.
Yeah, it's warm.
Gonna rock this up and down. Gonna get back in that left side of that submental fat pad. But it's never to move around too fast or never to move around too slow. You go too fast, you're not going to get the heat in that tissue. If you go too slow, you're going to make the client feel like they are burning, and that is definitely not a word we like to use around here. So it's kind of a medium movement. You'll see the skin get a little bit red, which means there's erythema, and that's completely normal. That means she's alive, it's fine. So this is really building that collagen and elastin up under there so she remains youthful for a long time. There's not a lot of modalities that ever did that. When I was in esthetician school, that did not exist. There wasn't anything that could help the skin with skin tightening that wasn't a surgical procedure. So this is pretty cool. How are we doing? You okay?
Mm-hmm.
Every once in a while, make sure you take a look at your screen for that temperature. We've got 2 minutes. Focus on that submental fat pad again. And so again, back to the fact that we're doing this on the lower face only. You can do it around the eyes if people have puffy under eye bags, okay? That would be worth doing because of the tightening of that's kind of needed. But if they have hollows, if they have circles, which most of us do, there's no need to do anything up under there except for, and this is where nurses come into play, except for cosmetic injections. Nurses or physicians can do that. And that helps to tighten up the wrinkles up under there, and of course to stop muscle movements in the forehead. So there's a place for all of it. Okay, about 1.5 minutes. No jowls for you. No, no, no. So again, for your notes, radio frequency this is the definition, it's alternating energy waveforms that produce nonspecific, localized heat in the dermis and epidermis. So it alternates between. We've got 45 seconds. Where do you feel like it got the most warm for you, Taylor?
Right near my nose.
Yeah, it's thinner skin there for sure. All right, 30 seconds. So all RF machines are made differently, I will tell you that. Some of them have screens, some of them don't. I like a good screen. It tells you your time, tells you your temp. And that way, in your chart for the client, you can write down what temperature they got up to, which is important. And, all right, Miss Taylor, there you go. The bell dinged at us. Okay, so this will be sanitized in a little while. So that is very important. If there's glide on your machine, you want to clean it. So we'll clean that, of course, at the end. So we're going to stop that. Thank you. And I'm going to hand sanitize. I'm going to take some gauze. We're going to wrap it around our fingers, dip it in a little bit of water. And we're going to really try to remove this, but I'm sure she's feeling a little agitated and irritated, right? From just having that heat. You doing okay? Mm-hmm. Probably the cool water might feel a little good. I will be honest. Okay. So in the spirit of not discussing brands, we are going to do an oxygen mask. And I'm sure Taylor knows which oxygen mask I'm referring to. So it's going to feel little bubbles, little champagne bubbles on your skin. Is that okay? Mm-hmm. All the sensations are happening today. Mm-hmm. Okay. This goes in the trash. Hand sanitize. And for this oxygen mask, it is one of those where you do put 2 pumps, 2 to 3 pumps. So this is a brand new one. So let me get it going here. We're going to put it directly in, here we go, in our palm of our hand, on our fingertips. We're going to massage it around and apply. And we're going to leave this on for just a minute. We'll do another nice massage on her chest while you can see the oxygen. But sometimes when your eyes are closed, Taylor, you're thinking, yikes, this feels like little ants on my skin, but I promise it's all good. I'm going to clean out those pores real nicely for you. Okay? I'm going to take off my gloves. Hand sanitize again, because that's never a bad choice. And we're going to massage. So we did some heat today. She's done with that mentally, I'm sure. So we'll do a little massage for you. And of course, we're going to hot towel all of this off. And she's smiling, so I think she's happy. Okay, so this is kind of that moment as an esthetician you want to just choose in your head, say, okay, I've noticed these things about her skin. And I want to choose a serum that pairs well with her goals. And so since we did a HydraTite, okay, of course we're going to do the antioxidant infusion with the machine one more time. But let's see, what have I got back there? I've got some squalene back there, which helps to bind a lot of moisture to the skin. It feels very silky. I think she might like that. And then we have got, what else? Ooh, we've got some stem cells. Stem cells help to produce new cells. So that's a beautiful thing. We like stem cells, so we'll do a little bit of serum application with that too. And then I've got a nice tinted moisturizer for her, or tinted sunscreen rather. We'll talk about ingredients in that shortly. So sometimes just, again, holding that head. And because you're doing a lot of massage, you might want to have a bottle of water waiting for your client at the end. That's always important. Hydration. Moves everything around in the body. Kind of moves things, especially out your lymphatic system. If you're doing kind of a medium to deep pressure here, and then just kind of feathering it out here in the neck area, that is part of your lymph nodes. So you just want to make sure that you're not bringing toxins into that area. You're kind of moving toxins out. So you see our little champagne bubbles are kind of dissipating. They're very active for the first minute, and then they kind of go away. And I don't know about you, but I like a good massage on the earlobes. It always feels nice. And if your clients will let you, you definitely have to ask ahead of time. I won't do this to you today, Taylor. But if they like a scalp massage, that always feels great. And that's usually something you would do if they were fixing to go to bed. For like an evening appointment, right? Put you to sleep. Okay. So we're going to take our hot towel and we're going to make sure that it's not too hot. We're going to put that little V at the bottom, test on our wrists, place this down. Too hot for you or just right?
That's great.
Okay. We're gonna do a little pressure here. And then we're going to roll this straight edge up under her lip. Hold the corner of her mouth wrapped tight. Hold the corner of her mouth wrapped tight. Okay. So now again, we're on our Serum Infusion piece. I'm using this to wipe my hands off. And normally I would say 2 pairs of gloves are good, but I decided to do lots of nice massage for her today. So we're going to try to put 1 more pair of gloves on here because we're coming back to our machine over here, our hydrodermabrasion, to apply a little bit of antioxidant infusion, and then we'll be good. All right, here we go. So again, we're going to take our hot towel and just compress a little bit. We're going to take the corners, unwrap here, pull this off of her skin like so, roll up, floss to the left, floss to the right, get all that up under there. That'll really get all that glide off the skin too. Make sure we're good. Towels always go in their own little bin to be laundered. Hand sanitize, and here we go. So we're going to press the on button one more time over here. We're going to put our Antiox solution on. Make sure it's coming up through our machine. And I'm going to sit. And this is where I will do a little kiss and twist action, simply to infuse the hydration in. No dragging. But we're taking that less dominant hand and massaging that into the skin though. And I'm really paying attention. So another thing that's important as estheticians is that we do lots of client care plans. So I am thinking, as I'm kind of wrapping up every treatment, what I need to talk to them about or write out for them to go home with is some recommendations for next treatment, some ingredients they need to know about, because y'all are little mini educators in the treatment room and the clients don't know, they want you to tell them. So again, kiss and twist all the way around. I'll usually do a pattern. You know, we'll do forehead, we'll do left side of the face, we'll do right side of the face. And we'll get that chin. And we'll get around the mouth. We'll get that little nosy. Okay. And then we'll get over here to this other side of the face. The antioxidants are phenomenal for the skin. Right after this, we're going to do those stem cells. And stem cells help to produce new cells by building them up. That's important. So again, this little technique is called kiss and twist, which I think is cute. But that makes sense. It kind of suctions to the skin and it infuses that serum right up in there. Might tickle, I don't know. Gonna get right here on this jawline. Okay, I'll leave it at that. We're gonna put this back in here. And at this point, I'm gonna turn off my Antiox, okay? And then I'm gonna turn on the rinse cycle because that's important. And then at the end, we're going to sanitize that cup on the back of the machine. All right. So now we're going to do a little bit of our stem cell serum. I love a good serum. And again, stem cells help to feed the skin with great nutrition that produces new cells. So we're going to apply that. Goes on nice and silky. I'm going to let that dry in. Okay. And then we're going to apply some squalene. Open this up, brand new bottle. There we go. Love how silky hydrating this one is. We'll do just a little bit more for fun. There we go. And then we're going to massage that into the skin. So if you want your clients to look like a hydrated goddess, I'm telling you, stem cells paired with some squalene, that's where it's at. Okay, so our final step is sunscreen. Our final step is sunscreen. So again, you know, if you have a client that is a normal anti-aging client sunscreen all the way. I always say that the contraindication, we'll turn that off now. Hopefully it's clean back there, pulled everything through. The contraindication of sunscreen is going to be your grade 3 and 4 acne clientele. They are the ones that have the redness and inflammation, and sunscreen ingredients typically will bother their skin and it will become more irritated. But for everybody else, they're good to go. Once you get your clients out of the grade 3 and 4, then they're good to go with their sunscreen again. So the ingredients you want in sunscreens are titanium dioxide and zinc oxide. So you want a physical blocker that's kind of rooted in dimethicone as a spreadable ingredient. That tinted sunscreen looks very nice. What you do not want is a chemical sunscreen that's typically very toxic to the skin. Look up for me. So I usually say, you may close down. I usually say you don't want the oxybenzones, octinoxate, and octisalate. You don't want any of those. So you want to make sure it's always physical. And Ms. Taylor, you look like a glowing goddess. I'm very sorry to say that you're done. Okay, guys, so that was the HydraTite facial. And now I'm going to write out my care plan for my client. She's going to be good to go, and we'll get her back in just a couple weeks for another one or a chemical peel, who knows. But that's because you know what they need, and you're going to go by their care plan. All right, we're done.